Hi, my name is Anita. My daughter's name is Jessica. She's 6 years old. And we came to Dr. Jari because she had difficulty with eating anything. She will eat only pureed food. She had difficulty paying attention. She does not like loud sounds. She's always scared in a big situation or parties. She was always looking at her fingers. She cannot walk in a straight line. She constantly crashes on things. In a big situation, she also has difficulty socializing and talking to people. So that is the reason we came to see. Dr. Jari explained that he has to do a detailed assessment before he can tell us what's going on with her daughter. And then he took his time and he conducted a detailed interview with us, and then he assessed her over a period of 2 to 3 hours, and then he told us that she has spatial neglect syndrome, and also she has sensory motor integration difficulties. So this is new to us because my daughter has had a diagnosis of autism since she was 3 years old. And anywhere we go, whether to the doctor or school district or regional center, everywhere they said she's autistic. But as a mother, I always felt she doesn't fit into the category of autism because she's a child that always wants to be happy. She wants to connect with people. But then because she has all these issues going on, it was hard for her. So when Dr. Jari gave us this diagnosis, it opened our eyes and made us understand why she was having all these difficulties. And she told us that she is not autistic, but she has spatial neglect syndrome, because which she has difficulty connecting to the space. That is why she's not able to eat normally. That is why she has difficulty balancing, walking in a straight line, not wobbling and all those things. So anyways, after the assessment, he also explained what the treatment is going to look like. He said the treatment is called brain remapping. It's all brain-based treatments. He has a lot of special equipment. He started the treatment using all of those applications on her. And also while using those applications, he explained to us clearly why he's using the equipment, what is the purpose, what is the area of brain he's stimulating. So it was all clear. He also explained to us in layman terms so that we can understand. So as the treatment progressed, I saw that she can follow verbal commands and translate it into motor movements, which was hard for her before. Like I said, she has attention issues. So when I tell her something, she cannot do it, especially when it is a motor task. She was unable to do it. Like she used to get frustrated. But as the treatment progressed, I noticed that she was able to follow verbal commands and translate into motor activities. She does not like to hug. So whenever we ask her to hug, she will go into a childlike pose, or she will hold her hands together near her chest. But again, as the treatment progressed, now when I ask her to hug, she'll open her arms and hug me like normal children. She's made progress in that. She's able to walk more in a straight line. She's not wobbling. She's also swinging her arms better. More than all these things, she's also eating better. Like she's able to eat yogurt and applesauce and all these things. Earlier, if it is a different texture, she will gag during every meal time. And most of the times she will also throw up. So this is another thing Dr. Jari has asked us to work at home. And then after every treatment session, he will ask us to feed her different textures and different taste. And we saw that her gagging has significantly come down. She doesn't gag like all the time. She only gags very few times, and she's making progress. And she did not vomit. She doesn't vomit. She used to vomit before. Even if she gags, she's able to hold the food inside. She's not vomiting anymore. So we've seen a lot of improvement in the last few days. We are so thankful to Dr. Jari, especially he's very compassionate and he explains everything that is going on to us. So we are well informed. Finally, I feel like I know what is wrong with my daughter. And finally, I know why she has all these issues and why she's doing all these things. And what's going on in her nervous system. So we are happy that we have come this far, and I have high hopes for Jessica. I'm sure she's going to make a lot of progress.
Jessica is just such a beautiful girl, and it even gave her wrong diagnoses. Not only she wasn't able to eat, but she wasn't even able to swallow anything but liquids.
Yeah.
She's 6 years old, and she's never even eaten anything.
Yeah. Yeah.
Wow,
Yes,
that's
yes.
amazing.
She also had other issues that I forgot to mention. Her swallowing pattern was not normal. Every time she has to swallow, she will struggle. She will struggle, and I could see the struggle on her face. And then she's 6 years old, but she will eat only pureed food. She does not eat a variety of food. She does not like to eat solids. Anything that I have to give her has to be pureed. So mostly she'll only eat rice and lentils and vegetables or meat that is completely pureed, and I have to feed it to her. She also doesn't feel hungry, and Dr. Jody explained us why she doesn't feel hungry, because she has a lot of issues going on in her gut. And now I'm happy that she's at least starting to accept a variety of food like yogurt and applesauce and soups. Even the pureed food has to be very bland. It's not a variety. So the pureed food, we just give her like I said, rice, lentils, and veggies.
Yeah.
I don't give her yogurt, because when I give her yogurt, she'll gag because it's too sour for her. Or even applesauce. So she will only eat pureed food. And even those foods, she'll gag a lot and she'll throw up. Now she's able to tolerate all of those foods. She's able to keep it in. She's able to keep it in. And she's also moving her tongue better. Earlier, she wasn't able to move her tongue to the sides. She was not able to move her tongue up and down.
To chew.
Yes, exactly. Now she's able to move the tongue just when I give her verbal directions. Okay, Jessica, move your tongue to the side. Now she's able to understand that. Move her tongue to the side. She's able to move it up and down. She also started biting. Dr. Jody asked us to introduce solid foods, like you have carrots and cucumber. He asked us to dip it in different sauces and introduce it to her so that at least she can feel the textures. So like I said, now she's better accepting all the textures. She's not gagging as much. She's not throwing up. And she's also biting these foods. She's able to bite vegetables.
Move her tongue before or bite because of the brain-gut connection. There was this disconnection, which is a very rare disorder or presentation in Jessica.
Yeah, whenever I put food in her mouth, earlier, she doesn't even know where the food is in her mouth. So it is hard for her to lick the food or swallow it or chew and all those things. Now, when I present the food to her, when I give her verbal directions, she accepts it. She puts it in her mouth. She bites it.
Yes.
And she at least moves it with her tongue.
That's the way things should be.
Yes.
That's wonderful. Okay, could you please tell us what makes Dr. Jody different?
Dr. Jody is very different from all the doctors I've been to, because at first, the most important thing to me is he's very compassionate. He's very loving and caring. He treats her like his own daughter.
Yes.
That's the feeling we get. And the second thing is, he keeps us well informed. He takes his time and explains everything to us, and he also makes sure that we understand. He treats us with compassion. So that is one thing that I've never seen anywhere. It's almost like he treats us like his own family.
Of course. Of course. This is what the important thing is, human life.
Yeah.
Yes.
To all the parents out there, if you have a child that is struggling developmentally, whether they have feeding disorder or speech or socialization or learning difficulties, and if you've been to many different doctors and if you don't think that has helped, and if you don't know why your children are going through this, I would say definitely bring them to Dr. Jody, because he is the only one that can explain and can give you the most accurate diagnosis. And he also has developed brain-based treatments that is evidence-based, and he has proven that this can work. And I have faith that my daughter has made huge progress, and she is going to continue to make progress, and she can lead a normal life. So if you have children and if you think they need help, I would say please bring them to Dr. Jody.
Thank you so much.